Then next, generating solutions or figure out what can I do about this problem. So here we have a patient who just underwent coronary angiography via the femoral artery. So what condition is this done to treat? And I think you guys should all know this one, but who would come into the hospital and get an emergent coronary angiography? And while I'm waiting for y'all to answer, we'll read on. So we're asked, which interventions do we anticipate in the initial post-procedure care for this client? And this is a select all that apply. And here's an NCLEX tip for select all that apply questions. You want to treat each option as if it's its own true or false. All right, Christina got it. Christina says ACS, that's correct. So if you've got acute coronary syndrome, we need to thread this catheter up. The cardiologist will do this to the site of the blockage and place a stent to open it up and restore blood flow to the heart. Francis says heart attack in all caps. Yes. So do we want to place them on a fluid restriction? True or false? And so I hope, and it looks like some of you have selected this one. Now remember, when we go up and visualize this, they're going to need to get contrast dye. And there's one organ in the body that hates contrast dye. It's the kidneys, right? If you give too much contrast and not enough fluids to flush it out, you can develop contrast nephropathy or kidney failure. We do not want to place them on a fluid restriction. We want to push fluids either orally or through IV or both. Good. Then monitoring the puncture site for swelling. Yes, because not only did we just puncture the femoral artery, which is one of the largest arteries in the body, but they also get aspirin and heparin and a bunch of anticoagulants for this procedure. So they are at high risk for bleeding. So we're going to go in there, look at the groin site and assess it for swelling, right? And so that is something we want to do because we're worried that they might bleed out into their leg or into their abdomen where we can't see it. Then placing them on continuous cardiac monitoring. Yes, I'm going to assume you guys know this because we talked about the fact that it's for a cardiac issue, either coronary ischemia or an acute coronary syndrome. And so there's always the risk that that stent can close or collapse and we would lose blood flow to that part of the heart that we just restored it to. So that is correct. Then assisting them up to the chair to prevent atelectasis. This is number 4, and it looks like about half of you or maybe a quarter of you are guessing this one. And so we do, in general, want to mobilize our patients after some kind of procedure. But in this case, remember, our priority is we're worried about bleeding at this site. And so if they bend at the waist, that's going to put a lot of pressure on this site and can risk life-threatening hemorrhage. So they need to stay totally flat for, depends on your hospital, but on the NCLEX, it's going to be 4 to 6 hours. So that is a long time to stay totally flat. And they're going to need some reassurance for how important it is. They need to keep that leg straight. So no, we're going to wait until they are off of bed rest to implement any kind of ambulation or getting up to the chair. So it's not this one. Then palpating their bilateral pedal pulses every 15 minutes. Yes, so remember, we're worried about bleeding. If we're seeing bleeding from this femoral site, that means the blood is going to go somewhere other than their pedal pulse. So when we palpate, we're going to have a strong pulse on the unaffected side and a weak pulse or absent pulse on the operative side. So this is definitely important. All right, so we're going to give IV fluids, not restrict fluids, keep them totally flat, place them on cardiac monitoring, and we're going to watch for bleeding by checking their pulses and looking at that groin site for bleeding. Very good. Well done.